In the high-risk maternity unit,
She's complete.
I'm ready to go.
5 couples are about to experience
Harder.
the unbridled joy,
Hold the breath in, honey. Push.
the unbearable pain,
Often we're caught off guard because it's just impossible to predict it.
Push.
and the unimaginable heartbreak and heartache of parenthood.
I'm going home today, and she's not.
First one's a little girl, Edith.
Because special deliveries are always full of surprises. At Advocate Christ Hospital in the suburbs of Chicago,
All the way out.
38-year-old Bonnie Bell is 34 weeks pregnant, and she's miserable.
Nice deep breaths.
At 3:30 this morning, her water broke.
We made a beeline for the hospital. Got here about 3:45 roughly. We were dilated to 1 first thing this morning, but that was several hours ago. Contractions about 3 to 6 minutes apart.
Bonnie is only 34 weeks pregnant with her first child. Her baby's gestational age, coupled with Bonnie's advanced age, puts her baby at high risk. To make matters worse, she has chronic hypertension and preeclampsia, a pregnancy-related condition of high blood pressure, which can result in seizure and stroke.
My water broke really early this morning, and here I am.
Ruptured membranes also put her baby at risk for infection. Right now, the slow-leaking amniotic fluid is the only key to finding out if this baby is ready to be delivered.
All right, are we ready? Let's go ahead and get the exam done, and then we'll be able to get you in a more comfortable position. When we do the exam, we're hoping to get a pocket of fluid that will allow us to put basically a little straw into it, a little catheter, and take about a teaspoon of the fluid to send to the lab. All right, excellent. Okay, here's the pressure part. All right, just relax and let everything out. All right, we're all done. So this is the amniotic fluid, and then there's some cervical mucus and some blood from the bloody show of just the contractions in the early preterm labor. In about an hour, hour and a half, we'll have an idea of whether we can go ahead and induce her or whether we should just expectantly manage her for the next 24 hours.
While Bonnie waits to see if her baby's lungs are mature enough for delivery, today, her contractions continue, getting closer and closer.
Atta girl.
Almost 4 hours after being given Pitocin to induce labor, 34-year-old Karen McKee is only at 1 centimeter.
At least we've started to make change. It's a definite improvement actually over yesterday, so I'll be back in a little while. We'll check again in a couple hours and see.
At 39 weeks, Karen's baby isn't due for 6 more days, but doctors don't want to wait that long to deliver this baby.
This is Karen's 3rd child. She has had a fairly significant laceration at the time of her first delivery. She suffered a tear through the mucosa of her rectum.
It's called a 4th-degree laceration, and it usually occurs with very big babies. In Karen's case, her first baby needed a forceps assist. Her second weighed over 9 pounds.
The 4th-degree laceration is typically an extension of an episiotomy that we make that tears both through the sphincter of the rectum and the actual mucosa of the rectum.
It's Dr. Michelle again. I'm just going to go ahead and check you.
While the condition doesn't affect the baby, women who sustain 4th-degree lacerations can end up with incontinence of the bowel, which requires corrective surgery.
And baby's still high.
This could once again happen to Karen because her doctor has already determined that her baby could weigh as much as 9 pounds.
The doctor just came in and checked me in. I'm at 3 centimeters, so hopefully soon.
4 hours later, she's still at 3 centimeters. The pressure is taking its toll on her husband.
I'm ready. Well, it'll happen. When it's ready, when the child's ready to come out, no sense thinking about it too much. The other ones didn't take this one. This one's going to be a stubborn one.
If Karen doesn't progress soon, doctors have no choice but to perform a C-section to get her baby out.
I'd prefer to deliver vaginally, but if I have to have a C-section, I'll have a C-section. probably freak out, but the baby's got to come out, so.
31-year-old Edith Sanchez is celebrating 31 weeks of pregnancy, carrying triplets.
Baby B, shift all the way over this side.
This pregnancy is a miracle for Edith and her husband, James. They've been trying for 6 years. 3 years ago, she miscarried 6 months into her pregnancy. This pregnancy is the result of in vitro fertilization.
I'm gonna have 2 boys and 1 girl.
I'm very excited. They'll make me young again.
But at 31 weeks, she's not far from her safe zone, so doctors give her terbutaline to slow down her contractions.
From 6 p.m. to 6 a.m., you get it every 3 hours. Okay.
She's also developed gestational diabetes.
And then before dinner, you know I'll give you your insulin. Yes. Right before dinner.
Right now, Edith is being carefully monitored. If her blood sugar soars, she could go into a coma. If the terbutaline fails, she could deliver prematurely. Right now, doctors need to keep her pregnant as long as possible.
They would like me to stay until 35 weeks to deliver.
That would be almost 4 weeks away. In Edith's case, an eternity. And as she's about to find out, an impossibility.
I'm getting ready to go and tell Mrs. Bell the information about the lung maturity test from the vaginal pool.
Deep. Relax. You got it.
We'll wait till she gets done with her contraction.
All right.
But before her doctor can deliver the news, Bonnie's contractions have gotten stronger.
Once the bag of waters breaks, you have about a 50% chance of going into labor over the next 24 to 48 hours. So with the discomfort you're having, we expect that you might be in labor. So you're halfway there, actually. You're 5 centimeters.
Oh, that's good.
So were you planning on getting an epidural? Okay. Okay. She's moving very fast. She's about 7 to 8 centimeters right now. And the head's starting to come right a bit lower.
Deep. Relax.
It's going to be a little bit of a race, I think, as far as whether the epidural will get it in time or whether she'll just rapidly proceed with her labor.
Okay, breathe.
With all of the commotion going on, the doctor still hasn't told Bonnie the results of the amnio. But now he's not going to.
There's a value of 29, which would be immature, but again, at 34 weeks, we would expect that if there is any respiratory insufficiency, it would be mild, and at this point, with everything else going on, I don't think she needs to hear about that, and we expect that we'll be able to show her a healthy baby, and then we won't have to worry about this. Really, really good.
Really good.
With her husband and twin sister at her side, Bonnie is about to get some bad news.
I think what's going to happen is you're not going to be able to get the epidural, and the good part about not getting the epidural is because you're going to have the baby real fast. But what we need to do is have part of you be able to pay attention to us and listen for my voice, and if I tell you to push, if I tell you not to push, to not push, and to just pin.
Come on, you're doing good.
Do the impossible and relax.
Okay. Move your foot. Relax. All right, you come on. Take a big deep breath in. Big deep breath in. Hold it. Just a push. Yeah,
Come on.
deep breath.
Come on, baby.
Don't let it go. Don't let it go. Breath in, honey. Push. Yeah.
Quick breath and one more. Save everything for this next contraction.
Okay, big deep breath in. Hold your breath. 2 minutes. Now with your legs. Push with your bottom. Push.
Come on, baby.
7, 8, 9.
Come on, push. Breathe.
There we go.
Look down. She's out. Look. Can you see? They're in the chair. See her?
10.5 hours after arriving at the hospital, Bonnie Bell gives birth to Olivia Pearl. But something's not right.
Baby's starting to cry. She's still pretty slight on it. A little dusky in the periphery.
Yeah, but we can give her just.
We're coming up on almost 5 minutes of life, and her color's better, her tone's better. If you see her, she's moving her arms and her legs on her own. She's got a good cry. She's breathing regularly. Her heart rate is pumping at a rate that's appropriate for this time of life.
Good. You did good, Mom.
All right.
Happy birthday.
Because of Olivia's prematurity and small size, she'll have to go to the special care nursery, where she'll be monitored more closely. But baby Olivia isn't out of the woods yet. If her immature lungs are not able to sustain her oxygen level, doctors will have no choice but to intubate her.
A small sign of a little respiratory distress.
A lot better.
What do you see your pains at?
They're very, very mild compared to earlier.
Late last night, Edith Sanchez was transferred to the high-risk unit.
But let me know. I can give you that Tylenol if you need it. Okay? Let me know if you need anything.
Okay, sounds good.
Almost 32 weeks pregnant with triplets, Edith has been contracting for 11 hours straight.
Oh, this is it. You know, they're coming. I'm gonna have the 3 of them, and with the pains being so strong, I just want this over with.
Doctors are fighting to keep Edith pregnant for another 2 weeks, but Mother Nature is winning this battle.
And they said if I start to dilate, then there's no question. They're taking me in, babies come out.
45 minutes later, Edith gets the news.
Dr. Foss came in, checked me, and he says I'm already dilated 2 to 3 centimeters. I'm just a little nervous and just crying right now because of the pressure. I have so much pressure. So, this is it. The day's here.
We're not going to be able to stop these contractions any longer. We're going to intervene and perform a cesarean section.
While nurses prepare Edith for her C-section, a team of nearly 24 medical staffers and specialists are standing by in anticipation. This is no ordinary delivery, because right now, the lives of 3 babies are at stake.
You got D, we have A. All right.
How you doing, kiddo? Looks like you're contracting pretty regularly.
So, that's a good thing, right?
That's a great thing, right?
31-year-old Shauna Patterson is 37 weeks pregnant.
Put your heels together.
And she's about to deliver her second child. By all accounts, this should be a normal pregnancy.
It's pretty much 100% still.
Okay.
But it's not.
My blood is attacking the baby's blood, you know, so kind of like sucking it dry.
And so her blood and the baby's blood is not compatible.
Shauna has an Rh-negative blood type. Her fetus doesn't. It's a deadly combination.
So she's creating antibodies to attack what her body sees as something very foreign, which is her unborn child.
It was very scary. You know, I was worried about her. I thought I was going to lose her. And, you know, it's been emotional. Like, you know, I've been praying, like, at night. You know, I just want everything for her to be okay, you know?
She's right there, though.
This condition occurs in about 2% of all pregnancies. It can result in anemia, a severely brain-damaged child, or death.
Well, the worst case scenario is that Shauna's immune system would attack the baby so severely that the baby would become very anemic, so anemic that the baby could throw blood clots or actually bleed, or the heart would just stop beating.
The only solution? Inducing Shauna to deliver right away.
Well, the longer we wait, the more Shauna's immune system has time to act. And the more time the immune system has to act means the more damage can be done to the baby.
Every minute counts. Shauna's baby's life is in jeopardy. She needs to deliver now.
Yeah, you're 4 centimeters now.
That was quick.
You're probably going to go on your own. You're contracting fairly well right now.
I just want to see her and kiss her.
Going up to labor and delivery, I'm being induced today. It's our second, so it's a little bit different. Thank you. Thanks.
30-year-old Cindy Jonkman is no stranger to Advocate Christ's maternity ward
Thanks.
because she works here as a labor and delivery nurse.
They always joke that if it's too busy, I can just chart it myself and they won't have to come look at me every half hour.
There's nothing more nerve-wracking than sticking a towel nurse.
You're making her nervous.
Cindy is 39 weeks pregnant with her second child. She's due next week. So far, this pregnancy has been normal, but her last one was extremely high risk.
I had preterm labor with my last pregnancy. I was bed rested for 19 weeks. Ended up delivering at 37 weeks. So with this pregnancy, they watched me real close.
This time, instead of experiencing preterm labor, she is experiencing no labor.
For some reason now, it doesn't want to come, so I'm being induced. There's lots of pressure.
3 hours into her induction, Cindy is barely past 4 centimeters. Doctors decide to break her water.
I'm going to rupture the membranes using a scalp electrode instead of the hook.
I went ahead and broke the bag of water, and that brought the station of the baby's head down to about a -1. Now we'll just keep going with the Pitocin to keep her contractions in a good pattern and see what happens.
Yeah, the contractions are stronger since I broke my water. A little bit more uncomfortable now.
Things are progressing finally, yeah.
Cindy's baby is slowly navigating through her birth canal, but his size may be a huge obstacle.
They're nervous this baby's just going to get a little bit too big. I'm nervous, actually. The baby's going to be a little bit too big.
Yeah, I think for the other side.
24 days after being admitted to the hospital for bed rest and observation, Edith Sanchez is finally about to give birth to her triplets.
Take the whole.
Yeah.
So good. That's deeper. Gone through the fascia. We'll go up first. And we're taking care not to injure the bladder. Okay. Okay, we're going to dissect our bladder downward. Okay, we're just about ready to enter the uterus.
Each baby will have its own team of specialists standing by.
Knife to me, please.
Uterine incision.
We're ready. Our first child is coming head first, so we're ready to deliver. Okay. First one's a little girl, Edith. Go for the next one. So that cuts.
While Mia Juliana is rushed to the baby warmer to be cleaned up and stabilized.
Our second child's coming with both feet first. Okay, our second little one is a little boy.
James Ian is quickly handed off to the neonatal team.
And number 3 is another boy. Number 2, second boy.
Baby C is Tristan John. And he seems to have the most trouble breathing.
What do you think, Jimmy?
Mia, correct? Okay, that's a sweet name.
Your Triple D, your son.
All the babies have to be rushed to the NICU. Edith only gets brief glimpses.
Yeah. Happy birthday to me, huh? Yeah. He's nice and warm. We're gonna take him to the unit and stabilize him. Okay.
It's a poignant moment because these babies are too premature, too small, and much too unstable to bond with their mother right now.
Okay, Mia. Here we go. I know.
Less than an hour old, the premature Sanchez triplets are finding life challenging.
Put a pulse oximeter on her to check her oxygen level to see if she is breathing well enough on her own.
The oldest of the trio, Mia Juliana, is also the smallest, weighing 2 pounds 9 ounces.
Ooh, she's a feisty dude.
But the main concern for any baby born 9 weeks early is its breathing.
She may not be able to continue and tire out, so we have to keep an eye out for that. And that will be evidenced by her breathing. If she were not tolerating this, her breathing would become very labored.
Baby B, James Ian, weighs 3 pounds 9 ounces. He took a turn for the worse and now needs to be intubated.
Our blood gases told us that the oxygenation wasn't what we wanted to be in ventilation, so we electively intubated for that reason.
Of the 3 triplets, he's definitely needing the most intervention, I would say. It looks like he was retaining a lot of CO2. He was oxygenating his blood kind of okay, but not ventilating very well. Without us breathing for him, he'd be in significant danger.
The intubation allows for immediate administration of Curocurf, a chemical that helps the lungs open and close. Doctors anticipate that within 24 hours, James's lungs should be able to function on their own. The youngest, baby C, is Tristan John. He weighs in at 3 pounds 8 ounces. Right now, he's on a nasal continuous positive air pressure flow, but that could change at any time.
These x-rays looked a little bit hazy, so he could possibly need to be intubated later on.
The baby's father is finally allowed to see his children. He brings his older son and daughter-in-law.
This is Tristan John. Mia Juliana. This is James Ian. They look the same, you know, sir.
Edith is still recuperating from her C-section.
He's hairy.
This is her first long look at her babies.
This is Mia, my daughter. And this is one of my sons. This is Jimmy. They're amazing. And this is my other son, Tristan. They said that, the first 24 hours are critical, and they'll be just under observation, and then I'll get further details tomorrow. And hopefully I can see him tomorrow. I finally have 3 children. Instant family. So I'm just very excited, and I can't wait to hold them and start being a mom.
See you later.
All right.
Bye.
Thanks for coming.
Olivia Pearl Bell was born 4 weeks early and was just under 4 pounds. She was smaller than doctors expected, but they also knew from the results of the amniotic fluid test that her lungs were not mature.
The first blood gas we have right now is not that great. It's actually kind of bad. So the blood gas kind of confirms that the child's having a little bit of respiratory distress and increased work of breathing. We're just going to confirm the blood gas. We're just going to check it again a second time.
But a second blood gas test showed more promising results.
Success.
Oh, make me happy.
I am.
Much better.
Much better.
Yeah, there we go.
That's good news for Bonnie Bell, who is on the way to the special care nursery to finally meet Olivia Pearl.
Oh, yes.
Uh-oh.
But
you're pretty.
We didn't want to get her cold yet.
Can't wait till she can come home.
At the rate she's improving, Olivia should be able to go home in a couple of days.
I don't even think I have words to describe it.
But the first 72 hours of life can shift from good to bad to worse in a matter of hours.
Yeah, okay.
It's nearly midnight, and Karen McKee finally reaches 4 centimeters dilation. Her doctors feel it's safe to break her water.
She's going to keep leaking fluid, but the buoyancy of the head will be taken away, and so the head will push down on the cervix.
Minutes later, Karen's cervix begins to open up.
I think she's a good 6. So she's progressing along. The head's coming down and the cervix is opening.
Hi, I'm Dr. McCauley. I'm a senior resident on call tonight.
Once her water is broken, labor speeds up dramatically.
She's complete.
I'm ready to go.
Within 5 minutes, Karen progresses from 6 centimeters to 10.
How close are we?
Very, very close.
Deliver this baby and find out if it's a boy or a girl, huh?
Ready? I'll push your leg back.
Push.
Push. 2, 3, 4.
Because of Karen's history with big babies and her 4th-degree laceration,
Take a breath. Come back one more time. And push. 2.
doctors perform a slight episiotomy to allow room for the delivery.
10. Good. Deep breath in. Again. Give it all you got. Push. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
But the baby is too big, and doctors call for a vacuum. Time is of the essence. In this position, his heart rate is dropping.
We're trying to help the baby out with a vacuum because the baby's heart tones down.
Give it all you got. Push. 2, 3, 4, 5, 6, 7, 8, 9, 10.
Push.
Push. Push hard. Going. 4. Pushing. 6, 7. Open your eyes.
All right.
He looks great.
He looks great.
The baby's head is elongated from the suction and pulling from the vacuum.
Say hi, Mom. Hi.
His head will quickly return to normal.
Right off, okay?
Martin Wesley is a big boy, 8 pounds, 6 ounces.
Okay, congratulations. Yeah.
But the delivery wasn't easy on him either.
We're just gonna take him back to the nursery with us to monitor him a little bit more closely for the first couple hours.
His airflow is below normal, and during delivery he had slight heart rate problems.
Boy, he's huge.
How big?
We don't know yet, but he's huge. Look at that face.
Oh, look at that pout. Do we have blue eyes, maybe?
After almost 20 hours of intensive labor and agonizing delays, the McKee family is complete.
It was well worth the wait.
Baby's coming down, though.
Shauna Patterson's labor is finally progressing.
After rupturing her bag of water, her cervix went from 2 centimeters to 4 centimeters. My guess is that she'll probably progress pretty quickly from here on out.
Now that her water is broken, her baby's head will push against the cervix and begin to open it up.
What we're going to do is we'll put another sensor on the baby and look at how well the baby's oxygenating. The cervix hasn't dilated much since the last check.
Right now, doctors are concerned about Shauna's antibodies attacking her baby.
Everything's okay. We're just being safe.
Then there's the matter of the baby's heart rate. It's falling below normal levels.
The baby is showing some variable decelerations. And variable decelerations can be caused by a number of things. One is if there's a cord tangled around the baby's neck. Another is if there's a decreased amount of amniotic fluid. Sometimes those decelerations can be concerning enough and compromising enough to the baby's health that we would need to do a cesarean section.
A normal fetal heart rate is about 120 to 160 beats a minute. Shauna's baby has decelerated briefly to 70. If the deceleration lasts 2 minutes, Shauna's baby could end up in extreme danger.
You're doing fine.
She's been moving all morning.
25-year-old Chancey Running is 37 weeks pregnant with her second child.
There's baby's nose. It's a nose, nostrils.
10 years ago, she lost her first baby at 22 weeks when she went into early labor.
Oh my goodness. You can like almost see what she looks like.
So you ready as you'll ever be for this?
Her early labor was caused by an abnormality of her uterus.
She has what's called a bicornuate uterus. It's kind of heart-shaped, and the pregnancy will take one uterine horn, either the left or right, and kind of make its home.
The bicornuate uterus occurs in 1 out of every 500 pregnancies. Its unusual heart shape can result in early labor,
Take good care of her.
and worse, it can cause placental abruption, where the placenta peels away from the uterine wall, putting both mother and child in danger.
Instead of being a nice round stomach, you can see that the baby's up over on this side of the uterus. It just comes up and around. This is where it's going to hurt.
To avoid the risk of a ruptured uterus, her doctor wants Chansey to deliver today, but her baby's lungs may not be mature enough.
Yeah, we'll see what the lab says, but we would like it to be a little bit more cloudy to know for sure that today is going to be a go.
In the next hour and a half, Chansey and Ed will find out if they're finally about to become first-time parents. "22 hours into their new lives, the Sanchez triplets are holding their own. Jimmy, the sickest, was having the most trouble breathing.
He's doing much better compared to last night. He's on a ventilator, he's intubated.
It was the dose of Curacurf, a chemical to help open up his lungs.
And that really made a big difference last night when he got his second dose. And so far, he's been doing great. I just did a capillary blood gas, and it looked really good. So we're waiting now for the docs to come for rounds and see what they're going to do as far as weaning him off the ventilator, which is a big possibility today, I think.
And today, the triplets are finally going to meet their mother.
I'm gonna go see my babies right now, special care nursery. I'm hoping they'll let me hold them, but I don't know, we'll see. And I know when I see them, I'll probably cry. I just still can't believe it. They're out, they're here. Hi, Sanchez.
Hi, I'm Bridget.
Hi, Bridget.
Taking care of Jimmy.
Okay.
And here he is. This is your guy. Come on over.
Oh, look at this. Hi, little guy.
I'm gonna warn you right now, this is an emotional roller coaster in here. You're gonna be up here one day, and then the next day, you know, you're gonna be down here because maybe, you know, one of them isn't doing as good as the other two, or, you know, two of them gained weight and the other one didn't. So expect that, okay? Don't expect them all to be, you know, doing perfectly every day. This is, you know, what it's gonna be like. But take each day at a time. Ready to see the other two?
Yes, I am. Oh my gosh, she's so hairy.
Hello, Mommy.
Hi, Mama.
Here's Mia.
Oh, she's so tiny. Hi, precious. And of course, you're the strongest one, I heard. There's no words to describe. I'm just excited. I'm amazed. I can't believe she's mine. After 6 years, I can finally say I have a child. Or children.
There you go.
Exactly.
In the middle of the night, Tristan, the youngest, had difficulty breathing. Doctors had to intubate him.
Got arm boards on both of
Yes,
his
he
right
does.
And like I told you this morning, they had to put him on a ventilator last night.
Okay.
It was just working a little too hard.
But there's good news, too.
They were able to decrease one of the settings on the ventilator this morning, so that's good.
Hopefully, James and Tristan will be breathing on their own by this time tomorrow. But most important, like most preemies, these three still don't know how to suck and swallow, which means they can't eat on their own, and they won't leave the NICU until they can.
She's doing very well from what they say, so I'm happy about that, because that means she'll get to come home sooner.
Bonnie Bell is going home today, but Olivia is staying.
They said maybe a week, so then I'll be happy.
But even a week seems like an eternity for a new mother.
It's amazing. It really is. I waited a long time for her, and I think you're going to get out, maybe. Yeah.
Olivia was born a month premature, and she developed newborn jaundice. Doctors have put her on phototherapy, a treatment where light is used to break down the excess bilirubin in the baby's system so that it can be easily excreted in the stool or urine.
We took her level today, it was in the 10s, and levels like that, you know, says that she still needs the phototherapy, and we'll check it again in the mornings.
Love you. I will see you tomorrow, okay?
Bonnie is checking out of the hospital. It's a painful process.
Come on, say goodbye.
But the good news is that Olivia can go home in 2 days.
It's just in itself a miracle.
And she'll be home in 2 days. I'm telling you.
I think she's just gonna sleep the night away. I don't think you have to worry. I don't think she's really.
Little happy, little sad. Because I'm going home today and she's not.
She's complete, head is at +2. We're in perfect position. We're ready.
8 hours after being admitted to the hospital, Cindy Jonkman is ready to start pushing.
The head is very well positioned, and we should have a short pushing stage.
2, 3, 4, 5, 6, 7, 8, 9, 10. Great job, Cindy. Come right back. 2, 3, 4, 5, 6.
But the pushing stage is anything but short.
Good job.
Okay, I think we're about 5 minutes away. Right there.
2, 3, 4, 5, 6, 7, 8, 9, 10. Great job, Cindy. Come right back. 2, 3, 4, 5, 6,
Very nice.
7,
Head's almost
8,
up.
9,
Big
10.
Her baby's head makes it through, but the baby's shoulder is stuck in the birth canal.
It's coming now, one more time. Big push.
2,
Coming.
3.
Doctors have to beat the clock to help the baby through. If they fail, the baby will die.
Often we're caught off guard because it's just impossible to predict this.
2, 3, 4.
In an attempt to displace the locked shoulder, doctors need to physically help Cindy's pushing.
One breath, big pushing.
2.
The baby is still having difficulty. The last resort is to break his clavicle to collapse the shoulder. But this too can be devastating, resulting in permanent nerve and skeletal damage. Doctors try one more maneuver. They literally corkscrew him out.
We take the back shoulder and we try to twist the baby in a circle while it's behind that pubic bone, and as we do that, we deliver the posterior shoulder first.
4,
Finally,
There we go.
the baby barely escapes injury. But even after delivery, he still isn't out of danger. He had a bowel movement in utero and may have inhaled the meconium, eliminated through his stool. Doctors need to clear his lungs before he sustains permanent respiratory damage.
Some terminal meconium. Didn't look like much when I sectioned up the oropharynx.
Because he pooed as he was coming out.
So he didn't take any in?
So probably not. And the reason why they called us is just to be safe, to make sure that he's doing okay.
Keegan Jonkman's lungs are cleared, and he is weighed.
9 pounds, 2 ounces.
And returned into the arms of his mother.
Oh, Cindy, he's gorgeous.
Another special delivery.
I'm gonna need you to let me know when you feel that pressure, okay?
12 hours after being induced, Shauna Patterson is finally ready to deliver her baby girl.
Big deep breath in. And big push.
1, 2.
Even now, minutes from delivery, Shauna's Rh-negative antibodies are still attacking her Rh-positive baby.
Here's her head. Here's her head. Okay, take a breath and give a good hard push. Come on, Shauna, you can do it.
In a worst-case scenario, her baby's liver and spleen can become enlarged. the baby can become anemic, and the fetus's ability to carry oxygen severely decreases.
3, awesome, keep it up, 5.
As long as she's in utero, this baby could die.
Okay, stop pushing.
Okay,
Stop
that's
pushing.
it.
But in a matter of moments, her baby will finally be out of the danger zone.
4, 5, 6, 7, 8, 9, 10. There's her head.
All right, look down, look down. There you go. There you go. Happy birthday. That's a girl. That's a girl.
She's healthy and pink, and another happy customer.
Oh, I don't want to hurt her. Oh, hello, little mama.
Babe, she's got your nose. I'm sore, but it's so like, anytime you have a baby, I think this is the part that makes it all worth it. I just can't believe that women can do this. Do you know what I mean? How we are able to do this. Like, we create life.
While Promise Elizabeth shows no overt signs of the life-threatening situation that she's endured for the past 9 months, her mother's Rh-negative blood has indeed affected her baby.
Now you know it's real, right?
She's 3 days old. She's just changing by the minute.
Born 2 months premature, the Sanchez triplets are surprising everyone at Advocate Christ.
Mia's still on a little bit of oxygen, not too much. We're weaning that down rather quickly. Tristan has no oxygen, he's on room air. They're both getting feedings of about a ½ an ounce every 3 hours. Mia's still getting her feedings through the gavage tube, which puts the formula right into her stomach.
Baby B, Jimmy, is doing the best. He's already been moved into the intermediate nursery and has learned to nipple from a bottle.
Hi, little guy.
Jimmy is in level 2, and hopefully he'll soon be joined by his brother and sister. But before they can go home, they need to survive on their own. In this case, they still need to learn how to eat. And until they do, their home is here at Advocate Christ.
It's exciting because I know then it's a next big step for him. It shows that he's progressing faster than I thought he would. But it's good, it's good. So maybe he'll be my first one to come home.
For Edith Sanchez, who endured pain and disappointment for 6 long years, the wait was worth it. A special delivery ×3.
This is some oxygen for you today.
The results from the amnio are back, and Chancey's baby's lungs are mature. She's about to undergo a C-section.
And there's a risk that my uterus could rupture, so they wanted to go ahead and take the baby so that there wouldn't be any complications with my uterus.
If there is a uterine rupture, there's a small but real chance that the baby's blood supply would be interrupted completely for a length of time that we wouldn't even have 10 minutes to go and deliver by emergency C-section.
After a heartbreaking miscarriage 10 years ago, Chancey Running is looking forward to a happier ending.
You just go through the abdomen in layers. We're going through the skin and subcutaneous tissue. Make an incision in the fascia that overlies the rectus muscle. And bladder blade. I'm just going to take the bladder down now so that it gives us the uterine surface in order to make the incision. Have a baby here in just a couple minutes. Knife, please. All right. Hang on just a second. All right. Hey, you're right, little girl. Say hello. Hey, she's glad to see you. Sounds great.
Despite her mother's abnormal uterus and the risk of a rupture, the delivery goes without a hitch. And Kyla Running appears perfectly healthy.
Came out kicking and screaming and Gave a nice cry for Mom right away to let her know that everything was all right.
Hello, here's Kyla.
After a tragic failed pregnancy 10 years ago, Kyla seems like a miracle.
She's got your fingers, definitely. Long little things.
Is that over there? The dark hair.
She's doing great. Nice. Pink and healthy.
Post C-section, Chansey doesn't want to stay in recovery. She's been waiting too long for this moment.
Now I'm going to the nursery to see the baby, and then I'm going to my room, I think.
At this time, she can only get a peek of her baby through the nursery window. But for now, it's enough to convince her that she's really here. Ten years ago, Chansey Running lost her baby. Today, she welcomed a special delivery.
We're gonna say bye to her. We're gonna give her a kiss goodbye. We're ready to leave.
Shauna Patterson and her fiancé, Terry Tinder, are getting ready to leave the hospital today.
She looks so helpless.
But Promise Elizabeth can't go home with her parents.
She's jaundice, and that's related to my blood type disorder. I feel horrible that I can't take her home today.
Promise has hyperbilirubinemia, which is directly related to her mother's antibodies.
What happens is that mom's antibodies breaks down red blood cells in the baby. One of the byproducts of the breakdown of the red blood cells is bilirubin, so it's directly related.
High levels of bilirubin turn the skin yellow. Extremely high levels are deadly. With the help of the lights, the bilirubin is broken down and excreted from the body.
If we didn't place Promise under the phototherapy lights, she could progress with the problem and get very, very sick, potentially have brain damage and die.
We'll see you.
So how is it? How are you feeling?
Very helpless.
I'm gonna take her home.
For these new parents, going home empty-handed is heartbreaking.
$20 hours, worth every minute of it.
Today is homecoming day for Martin Wesley.
What's your brother's name, David?
David.
No way.
Rounding out the McKee family is sister Gracie and brother David Edward III.
These are going to be our big helpers.
Yep, they are.
With mini Mark there.
Come on, guys. We are going home, finally.
Today, Martin is going home to enjoy his new status. One he shares with 6 of Advocate Christ's other bundles of joy. A very special delivery.